How do you know if you have a bile deficiency? First, I'll go over the symptoms and then what you can do about it. So one is you have gas and bloating, especially after a fatty meal. You have jaundice. The whites of your eyes look more yellow in color. You have constipation. Your stools float and they are a light tan in color, so they're lighter than the chocolate brown that they should be. You have deficiency in fat-soluble vitamins, and I'll go over how you know whether you do or not. And you've been diagnosed with a fatty liver or gallstones. Okay, so why does this occur? But before we go into why, I really want you to understand all the wonderful things that bile does for you, so you'll want to make sure that your bile levels are optimized. So bile is a detergent, and just like you use a detergent to clean your clothes, what bile does is it cleans out the upper small intestine from any bad bacteria. This would prevent gas and bloating, small intestinal bacterial overgrowth, things like that that are going to throw off the balance of your overall gut health. It also breaks down fatty foods. So in the fat in your meal, it helps break it down and also allows you to absorb the fat-soluble vitamins, vitamins A, D, E, and K. They also, bile acids prevents fat and toxins from building up in your liver, and that thereby a good flow of bile actually prevents fatty liver from occurring, which is very important. It balances insulin sensitivity, so improves insulin resistance is another way to say it, and also regulates how your body metabolizes or breaks down fats. It lubricates your colon, which is why when you don't have enough bile, you're constipated because that lubrication is not present. And it also neutralizes your stomach acid. So it's very interesting how the pH, acid basic, changes as you go through your digestive tract, because you chew your food, you swallow it, goes down your esophagus, which is pretty neutral in pH, and then bam, all that food enters the stomach, which is a bag of acid. That's what your stomach is. That's its job. It should be highly acidic, but when the contents have been churned around for 2 to 4 hours in your stomach, then it leaves and it goes to your small intestine and it's very acidic, but your body is not designed in your small intestine to have acidic contents go in it. So what does the body do? Right when the stomach is emptying out into the small intestine, your gallbladder secretes bile because the bile is very basic, and so they neutralize one another. So now you have a more neutral substance in the small intestine, which makes it happy. So bile neutralizes your stomach acid. So that's very important for optimal digestion, because in your small intestine, a great deal of the absorption of nutrients takes place. But if that pH is wrong, it's going to be disruptive and you're not going to be able to absorb as well as you should. Also, bile prevents in the colon overgrowth of bad bacteria. So it's doing it. It has its detergent-like action in the upper small intestine, but also lower down in the colon. Okay, so if you're deficient, one thing you're going to be deficient in is the fat-soluble vitamins, obviously, because the bile is not allowing you to absorb them. So vitamin A, if you're deficient in that, you can have dry eyes and you can have trouble seeing at night. Vitamin D, you can have bone pain, osteoporosis, a weak immune system, decreased mood, so feeling a bit depressed, also decreased immunity, meaning you're getting sick too often. So vitamin D, it does an incredible number of things for you. Then we go to vitamin E, so you can have dry skin, hot flashes, weak muscles, numbness or tingling, as well as anemia. Lastly, vitamin K, especially vitamin K2, when they're deficient, you can get an increased risk for kidney stones, increased risk for calcium being deposited in your arteries as well as in your joints, and you can bruise easily. So those are all the symptoms associated with your fat-soluble vitamins. Also, when you're deficient in bile, you can have jaundice, which is the white of the eye, as I mentioned earlier, turns yellow, and that's showing that you don't have enough bile, and it starts to become toxic, and you want to go to your doctor if you see the whites of your eye turning yellow. Constipation, we mentioned why that happens, and then also the fatty liver. We know that bile helps prevent a fatty liver, and fatty liver is getting more and more common in our society. It's definitely due to decreased bile, but it's also due to high insulin levels, and interestingly enough, bile helps monitor and make you more insulin sensitive, which is what you want. The bloating and gas after a meal is simply because all the fat and the fat and the fat-soluble vitamins, everything's just sitting there because nothing can be absorbed and broken down. So you feel a little nauseous if you don't have enough bile to digest your fats. And then, of course, you can get diarrhea and greasy stools, or constipation is more common with decreased bile. With bile that's sort of flowing too fast through your system, then you're more likely to get diarrhea. Okay, so the stools float, as we mentioned, because you're not absorbing the fat, and then you can get gallstones, another symptom of not enough bile, because the bile is not flowing through the gallbladder the way that it should. You've got stasis, you can get sludge, and then over more time, the sludge turns into bile stones. So, why does this all occur? One is a very low-fat diet. It turns out that the gallbladder needs to do its job, and it's a receptacle. It's a storage unit basically for bile, but that bile has to flow out of it. It has to be, your gallbladder has to be exercised, if you will, to do its job properly. And so if you're on a very, very low fat diet, you're not asking the gallbladder to secrete or do its job, and then you can get the stasis, the slowing down of bile, the sludge, the stones. So you want good fat. You want some olive oil, in moderation, but some olive oil, avocados, nuts. So healthy fats are very important. Then, of course, you can get decreased bile because you have a fatty liver, and the liver is so congested, it's not making enough bile. And that's a bit of a catch-22, because you don't have enough bile, and now you get a fatty liver, and you have a fatty liver, and you don't make enough bile. But the liver is a very strong organ. You can heal your liver. It loves to heal. There's a lot of natural things you can do for your liver. So what I'm going to give you are some things you can try on your own, but you might need more help. So just be open to that. But bitter foods like dandelion and artichoke, radicchio, arugula, the bitter foods, the bitter greens that you have to get used to those if it's not something that's commonly in your diet, but that can really help. Also, some lemon, some apple cider vinegar, you can see how those do for you as well. All right, and if you have already lost your gallbladder, check with your doctor, but supplementing with some ox bile or bile salt supplementation mid-meal to give you more of the benefits of bile can be very, very helpful, especially with your symptoms, and just not putting as much stress on your liver, because what happens when your gallbladder is removed, that instinct of the gallbladder, when it senses fat coming out of your stomach and it secretes the bile, that whole process has been eliminated because there's no gallbladder anymore. So instead, what the surgeon does when they remove the gallbladder is there's just a steady flow of bile coming out of your liver. It's not that beautiful instinct of sensing fat and only secreting it when it's needed. So sometimes people who've lost their gallbladder tend toward actually diarrhea because they have too much bile flowing. So depending on what you feel. So you don't need the supplementation, the ox bile or the bile salts if you have diarrhea, certainly. But if you're on the other side of things, then you can speak with your doctor and see what he or she recommends. Now, You can also get decreased bile because you have some colon disease, you have Crohn's disease, IBS, IBD, and these diseases, depending on the severity that you have, we've certainly seen a lot of improvement with patients doing natural programs. So finding a clinician who really understands that so you don't get so much inflammation and irritation to your large intestine so that you can get all the benefits of the bile is very important. The dysbiosis, as I mentioned a couple of times, the lack of good bacteria in the colon, the bile helps maintain the good bacteria, but you also need a good balance so that bile can be recirculated. 95% of your bile is recirculated. Only 5% is excreted, but when it's excreted, it's taking excess cholesterol with it. So you have a lovely vehicle for getting rid of excess cholesterol. And so I hope this helps you appreciate the importance of bile, how you might know symptomatically if you don't have enough, and some natural things to do about it. But then if you need more help, being able to get that and finding someone who can help you. Certainly we're always here for you, but finding a clinician that you feel comfortable with who's very astute in how to naturally improve your liver and your bile flow. Okay, I hope you found this helpful. If you did, give it a thumbs up, comment. I love reading your comments. I answer pretty much all of them. And consider subscribing to the channel so more people can get exposure to this kind of information. I'll talk to you soon.